So that's why we got delayed. So really sorry for that. So let's start.
Let's
Okay.
start the session. So all of you know that we are announcing in Instagram also regarding the course orientation. Today we are going to conduct the live session. So as you all waiting for the live session also, and this is one of the very important live to conduct to know better the nursing courses.
Yeah.
So you already know what are the nursing courses will be there. So in detail today we are going to discuss throughout the live. So we will see the next slide regarding the nursing courses. Okay, we know that nursing is one of the biggest healthcare system, delivery system, and we are providing a care for the patients, and it has their knowledge, and also and day by day the community is growing and the profession is building its own beauty, right? No?
Yeah.
So it is going to be reached in the India as well as in the abroad also. It is going to take a good place in worldwide. So we have to know how the career path will be there, how they have to do the courses, and how they needs to join, what are the benefits if they come and join with the diploma course, or they can join with the UG, PG or PhD. Somewhere it is going to be an end, right?
Yeah.
So where it going to be, see how the path will be there, entire things we can see.
Yeah, so it will be different from one to another.
Yeah.
So first we are moving to the like we already completed. So we just need to complete like 10th and 12th. So after that only we can join the nursing. So before that we can't join, and it is mandatory that we have to complete 10th and 12th. So without that we can't join in any of the nursing degrees.
And meanwhile, it is having a scope while worldwide, as I said, it is having a scope in the European countries,
Yeah.
all the countries which is there on our earth. And in the meanwhile, in India, in our country also, we have a huge scope for this.
So
And
there will be high demand.
Yeah, high demand will be there, and we have to see the difference between the European countries' job opportunities and as well as the Indian job opportunities. That and all we can discuss in detail in this live session. Then, what are the opportunities will be there when it comes to the nursing? What kind of career you need to choose? If you are really finished your nursing, you have some kind of myths will be there, doubts will be there. So those kind of doubts you have to get the clarity, means completely watch our live.
Yeah, and if you have any doubt means you can in between you can ask. So you here to clarify it.
Yeah, you can comment it down and we will definitely clarify it. And we can see that general nursing midwifery, the first course. So we have certain courses that I will tell you, ma'am.
In nursing itself, it is divided like BSc, MSc, and GNM. So this is the different types in nursing.
Yeah.
So first we are moving into the GNM. So general nursing, that is.
Yeah, general nursing midwifery, GNM means for this basically what is that it is a diploma level program. Okay, it is not a degree level program, it is a diploma level program. If you finish your intermittent, like if you completed your 10th and plus 12 in any combination.
Yeah, it is not mandatory that you
For
have
you
to take
finish
the
your-
science subject. So if you are in commerce, if you are in humanities, whatever it is, you can go to a GNM nursing.
And like if you stream with any kind of subjects, as ma'am told, we can get the admission.
And this GNM is a 2-year course.
Yeah.
So it's like 2 or 3. It's 3-year
3
course.
years plus 6 months of
Yeah.
internship should be included in this particular course has been designed. And the admission criteria and all we can look into the particular session. This is very important in sake of to get the admission and study this particular course. Okay. So as we already discussed, ma'am, that we come to know, right, this is going to be plus 2 and 10th is 10th and plus 2 is a mandatory, and
we have to get that 40 to 50% in 10th and 12th.
plus 2.
Yeah.
So, and meanwhile you have to like focusing on the subject like English also, that is also very mandatory kind of subject, and you have to get the aggregate marks in the English meanwhile. Okay, so the next one, the age. So you can admit for this particular course means you have to complete your 17, like mandatory is 18. After 18 only you are getting the admission in this, and till 35 years you can get the admission.
And the duration we already told that it's 3-year course, 3-year plus 6-month internship. So 6-month internship you will be doing in, of course you will be doing in hospitals.
You
So,
get the clinical experience
clinical
as well as the
experience.
practical things you have to complete, and you will gain good knowledge in the hospital sector, because this course is entirely designed for the clinical sector.
settings. So it will be more, it is like clinical, like hospital experience. You can exposure more into the hospitals rather than the theory, because we need that clinical experience more when we are working in the hospital. So it is the best thing which we are taking, like GNM nursing.
Don't feel that I am taking people are having that myth and all. They are feeling that right now they are having like science stream, not they are studying, they only studied commerce, arts. No need. Instead of all these professional courses, like we can choose this one, means particularly irrespective of your combination we can get the job.
So one more thing, like that most of the Mallu guys, they are having some myth like GNM is not that much good, but അങ്ങനെ ഒന്നുമല്ല. GNM like same like BSc പോലെ തന്നെയാണ്, but 3-year course ആണ്, and more exposure clinical settingൽ നിങ്ങൾക്ക് കിട്ടുന്നത് GNM-ലായിരിക്കും. GNM ഒരിക്കലും അങ്ങനെ ഒരു എന്താ പറയുക BSc-യുടെ അത്രയും ഇതിൽ അങ്ങനെ കുറേ പേര് എൻ്റെ അടുത്ത് പറഞ്ഞ് ഞാൻ കേട്ടിട്ടുണ്ട്. അതാണ് ഞാൻ ഇത് എക്സ്പെഷ്യലി എടുത്ത് പറയുന്നത്. സോ അങ്ങനെയല്ല, ഇതിൽ മോർ നിങ്ങൾക്ക് ഒരുപാട് എക്സ്പോഷർ കിട്ടുന്ന ഒരു ഇതുകൂടിയാണ് GNM. If you are taking in GNM.
Really, if you are people are getting low amount of marks like in +2 or somewhere, they don't know what to do, that this is the best option they can choose, and definitely you can grow in your career. So next we can see the next course is BSc Nursing. As we all know, we all studied BSc Nursing, one of the best and wonderful course that we can build our career with this. And it is like a Bachelor Science in Nursing. It's a purely degree course, has been designed by the university.
That's a 4-year course.
The professional degree program it is and the strong theoretical and clinical foundation. You will get both the theory and the
as well as the clinical. Both is equally mandatory. It's very important, like both you have to maintain, like clinical you have to maintain, along with that the theory also you have to maintain.
I used to tell my students every time this clinical practice and as well as the theory is the same both are the two faces of the same coin. So if you are less knowledge in theory, you can't able to work in the clinical sector. If you are less knowledge in practical, you can't able to gain marks in the theory section. So for that reason both are very important. If you really wants to do the career in nursing, definitely focus on both the things, and you have to it is like a service, and you have to put your 100%
full effort in that.
You have to put your 100%, your dedication plus hard work, then only you will get the success.
For some people they won't like the clinical, so they will more focus on the theory. But there will be no use. Both you have to maintain, like both full effort you have to give in both the subjects.
Skill also needed and theory also needed. Okay, so that is why you have to focus more, and you have to dedicate your life towards the profession, and required for higher education and abroad opportunities. Okay, so we can finish this one, means definitely we will get the opportunities in abroad as well as in the India.
If you are a nurse, like BSc nurse, ningal BSc nurse ആണെങ്കിൽ നിങ്ങൾക്ക് abroad opportunities ഒരുപാടുണ്ട്. Like most of the people അത് അറിയാം അങ്ങനെ opportunities. You have to pass the exams, you have to gain all this experience, but you have to get that experience in any of the hospital. After that you can go any abroad. Otherwise you will feel that difficulty if you are not getting any experience in the hospital side, and without that you are going abroad, you are planning to go abroad, means there will be no use. So first you have to take the experience and just you can move into any of the countries.
So definitely you can have the skill, means you can work anywhere. So for that reason skill enhancement is needed. So by India itself you gain it and you can move. And one more thing I want to discuss, right, we are having that feeling if in +2 and we can't able to study mathematics. Okay, so for that we used to go that biology and we will choose our nursing. For that that is the reason.
One correction also, there will be statistics will be there in nursing. So it's little bit related to mathematics, and there will be biochemistry, bioscience will be there. So you have to just get a clarity of this. After that only you will get all those things.
And one more thing, in mathematics is bit difficult. That is why we choose a nursing, means if you go hospital, doctor will tell all the drug calculations.
Drug calculations very important.
How they will tell. you know, right, how they will tell,
Yeah, they will
this is the thing, this is this much ml of you have to calculate and this much ml of you have to give. By the time mathematics is also very, very important.
They will just give the hint. After that, we have to calculate all those things, and we have to get that clear idea. Is it is correct? If there's any, we have to just double check with any of our seniors also if we are doing the correct. So we have to get that clarity, and we have to know the how to do the drug calculation. It's very, very important, right? No?
Yes,
Yeah.
ma'am. The next we can go with the like admission criteria and duration for this BSc nursing. We can see here that admission criteria 10+2 with the PCB and English. That's what we are mentioning here, to that you have to come with the science stream. So without science stream you can't able to join for BSc nursing. Okay, diploma you can join, but BSc it is not possible. So this, what is this PCB? When it comes to this PCB, physics, chemistry, biology is the mandatory subjects, plus English you have to gain the at least mandatory marks. Like nowadays 50% they are asking, and even though you have to 45 to 50% they have to get the aggregate marks, and meanwhile ma'am they have to attend the CET examination. Especially who are want admission in Karnataka, nowadays means from past 2 years they are like conducting the examination from the KEA board, that is what CET, common entrance test. So after that you can once you return that one, you will get the aggregate marks and rank, then only you can get the admission in the various nursing colleges which is present in Karnataka and Bangalore, anywhere. Okay, so the admission criteria also bit changed from past so many years to now.
When we are studying, it was not like entrance exam before, but now it is mandatory, I think, right?
You tell in Malayalam that one.
ബിഫോർ നമ്മൾ നേരത്തെ പഠിച്ച നമ്മുടെ ഒരു ടൈമിൽ പഠിച്ചുകൊണ്ടിരിക്കുന്ന ടൈമിൽ ഈ എൻട്രൻസ് എക്സാം അത്ര മാൻഡേറ്ററി ആയിരുന്നില്ല. ബട്ട് ഇപ്പോൾ ഈ ഒരു ടൈമിൽ എൻട്രൻസ് എക്സാം മാൻഡേറ്ററി ആണ് ടു ഗെറ്റ് ദ BSc നഴ്സ് കോഴ്സ്.
So see, nowadays it is there, you see the KA website, there they are mentioning all the dates to register and all, so you can easily register and you can join the courses which is available in Karnataka also. So the next one, minimum that we have and duration is 4 years, internship also included in that only. Okay, so 4 years, currently the semester batch has been going on, so in few days only we are getting over with the first semester batch of BSc nursing in Karnataka. So all over the things you have to mentally prepare what are the things which will be there. If you want any like any kind of materials or any doubt you have, means kindly comment it down and we will definitely clarify it. And one more thing, if you want any kind of academics related things, or else you want clinical related things also, you can comment it down. We will definitely going to solve it and clarify the doubts. So this is the main things, and internship also which will be there in this one only. And 4 year means 8 semester is there. Okay, so this is a semester based curriculum has been designed. So in upcoming live sessions we are going to discuss regarding the syllabus orientation of each and every semester also. So now we can move with the post basic BSc nursing. So before going to this one ma'am, we given information regarding the
general nursing,
GNM. So
this is designed for if you have taken the GNM and you need to get the BSc in nursing, so you can select this post BSc. So whoever completed the GNM, the people can go to the post BSc. So this is the same like BSc, like it is also 2-year course after the GNM. So this is a two-year course.
Yeah, post basic BSc nursing. After the diploma of your nursing diploma certificate, you can go through this post basic BSc nursing. It is one of the course designed to make diploma students to get bachelor degree. Okay, so you can take a professional degree after completion of the diploma course also. That is very, very important. You can't able to, you are unstoppable guys. You finish your diploma, okay, I can work in the clinical sector, that is what my like limit. It is not like that. You are like unstoppable.
If you are interested in studies, then you can go for the post BSc.
If you go through this, you will definitely work in various sectors. Okay, later we can discuss about that also. Then this is upgrades diploma to degree and enhance the promotion and teaching opportunities. That what I told you, that the professional opportunities are going to be enhanced or to build proper opportunities for in the academic area. Okay, so once you are finishing your GNM, kindly go through the post basic BSc. Okay, so your opportunities are waiting for you and you will get the nice opportunity to grab in the academic
Total,
area.
it will take like around 5 years,
Ah.
like 3 year GNM plus 2 year post BSc. So it will completely like 5-year course.
Yeah. So the next thing, admission criteria. So we know that we are talking, keep on talking on the GNM only, okay, right? So if you are completing your GNM, you will be assigned as a staff nurse.
Registered nurse.
Yeah.
So yeah.
Registered nurse or registered
mental,
midwife. Midwife. So after you will get your registration. So the, as usual, already ma'am told that 2 years of duration it will take to complete your degree. Okay, to promote from GNM to post basic BSc nursing, you will take a 2 years. If you are regularly doing, means if you are distance and distance means it will be take 3 years, but distance is not available for the healthcare courses. So you know that, right? So this is the criteria. You have to like get the admission, means any private colleges you will get the admissions according to your GNM marks. There also they are going to calculate the 50% of marks. Okay, if you fail means you will never get the
That's very important.
yeah. Next thing is who are completing BSc nursing, who they wants to be excellence or they wants to gain more knowledge in this particular field. This is one of the very much good field to grow knowledge. Your knowledge means theoretically or academically to enhance your teaching skills, means this is the best area. So that is what post graduation program MSc nursing. Okay.
So the BSc is not the end. So if you are still interested in study, then you can go for the MSc. That will be better option, because if some people they will not be like in working in a clinical setting. So if you are taking this MSc, means you can work at the principals. If after that PhD, you can do the PhD. You can work in any of the nursing educator. Yeah, you can work as a nursing educator in hospital itself if you are not interested in clinical setting. So there will be many options for this MSc nursing. So if you are interested in studies after BSc nursing, then this is the best option, that MSc nursing. So in specialities, so there will be many specialities like medical, surgical, OBG, child health, psychiatric and community. So these all are the specialities. So whichever is you are liking to more interested, so you can give the full effort into that and you can select that subject for the MSc. So it will be good for you also, because some people will not be liking the psychiatric. They will be liking medical, surgical. So you can take the medical, surgical as your
specialty subject. Okay.
Specialty.
And then you know that when we are studying in the BSc, it seems we are having that knowledge that this subject is my favorite, this subject I have interest more, this is OBG, everybody is telling that OBG. Once you enter to the 4th year, your life will become like full of OBG only. So far that everybody is very curious about obstetricals and gynecology, and it is one of the very interesting subject also. So how to handle the baby, how to treat the postnatal mothers, antenatal mothers, whatever the complications will be there, lots of things are very curious things we are going to study in this particular
that will
unit.
be special kind of
And you will get also one of the you know, right, you can't able, like everybody was not seeing the childbirth in from past so many years, but once we are entering to the 4th year, definitely we will post it in the
at least once you will be seeing after getting
you
the
will see that first time you share your experience once we saw that first childbirth. By the time we feel our mother is so special, our mother, like we until and unless we are not feeling something else, but after that we will say everything what mother will tell, yes ma, like that. See, and like that kind of one of the beautiful experience which
that
will be
special
given
kind of experience when we are entering to the OBG.
That is very nice, and that tiny hands we are holding. Oh my God, this is so good. And so, like that only, if you go and visit a psychiatric posting
Psychiatry,
also, it is when really you will see that life how it is. You will see the reality of the life. And the next thing is medical, surgical, and like OBG, medical,
Medical surgical, almost I think everyone
you
will
will
be
see
yeah.
that every disease condition. You
We
can
have to
explore,
get that idea,
you
yeah.
can explore plenty of disease condition in medical surgical, and surgical department is also one of the very unique department,
Yeah.
and we will get good knowledge like operation means once the surgery will
After-
done,
yeah,
pre-operative,
post-surgery, yeah, post-operative
post-operative.
surgery.
See, why we need to study means why the study and why the academics are important. See, if you know that pre-operative care, how we can say it?
Yeah,
we
when-
can
we are
use
doing, yeah.
we can
When
use
once we will get a patient like pre-operative patient, so many pre-operative procedures will be there. We have to do that as a nurse. We have to do. So we have to get that idea. What all the things we need to do. So for that we have to get that theoretical knowledge. It's very important, as well as the clinical knowledge. So then only we can practice into that. Without any of the knowledge, we can go and we can do the care for them. So it is very important. You have to get that theoretical knowledge, because procedures, it will be different. Post procedures will be different. Pre procedures will be different. So we have to know what all the things, what all the medications, what all the things, and the doctor's order. Everything we have to look into
And
that
informed
properly. Yeah,
consent.
that is very important when we are informing. We have to take the consent from the patient, from the family members, from the doctors. So there will be huge procedures we have to do. So that
communication,
is very, yeah.
the communication is the basic key that between you and the patient, the
Because
interpersonal
they will be anxious.
relation.
Anyway, they will be
Yeah.
anxious when they are going. If we are going for a surgery, we have so many doubts. What time they will be doing? What surgery? What are the things we need to do? So
After the
everything,
surgery,
yeah.
what are the complications will be there? What is the effect? This is the only way to clear our problem. So lots of doubts we have. So those kind of doubts and those care. So if you excellence through your education, definitely you will shine in your own.
Yeah,
path.
because day by day we will get new knowledge, new skills. So it's improving our knowledge also. Yeah.
Nowadays you saw that palliative care,
Huh.
how it has been enhanced for providing the elderly people the palliative care. Nowadays doctors are taking training, and they are approaching the 6 months of course in online and offline. They are going and taking the palliative training. For nurses also, so many conferences and all conducting on this topic only. So to enhance your knowledge, this is one of the best to research, okay, especially that research. Very nice.
Yeah, research.
You
All
only
the
know.
students know how the research will be, how
You-
difficult it is, and still now most of them don't understand that how the research work
Yeah.
on. Yeah.
See, once you know this types of research that you remember, ma'am, that
Pyramid or
classification
yeah.
will be there. So you study that one. Which type I study, that you will be confusing matter. That is, you will study means definitely.
We have to take the presentations. We
Huh.
have to present it in front of everyone. So that is, everything is different feeling that when we are taking the MSc, you will get into more that.
Yeah, it will boost up your confidence also. Standing in front of somebody else and taking classes or teaching them, talking with, it's a talk, okay. So it needs a certain skills and confidence. So that is not very easy. By joining this course, you will get all the qualities. It enhance your knowledge and it enhance your qualities and teaching abilities. Okay, you will enrich with your continuous research process also. It may give you lots of opportunities in the research field also. So that is why don't stop. You are unstoppable. Nurses are unstoppable. You can go through all your courses, get a PG, get UG. If you complete your diploma, definitely you go with a post basic. If you complete your BSc, definitely you go with this MSc nursing. The next thing, the admission criteria, same like admission criteria, you have to complete
The BSc you have to complete. And
or
the
else if you
post-BSc,
complete post basic also, you will get the
Yeah.
admission.
And that's 1 year clinical yeah, that is very important. Like after BSc, you have to get 1 year clinical experience, then only you can get the MSc. Before that, directly we can't go for MSc. So you have to complete the BSc. After that, you have to take 1 year experience in the hospital. Any of the field you can take. After that, you can go for the MSc nursing. then you have to go for the entrance exam, same like the BSc.
CET, okay, so PGCET will be there, so you have to attend it, and after that duration of the course will be that 2 years, okay, 2 years of MSc course will be there. So if you are interested, you can go and join with this.
That's also special kind of.
If you have any doubt regarding your synopsis, regarding your dissertation, your like whatever the process which will be there inside this particular course, if you have anything, please do comment it down in our comment box, and we will definitely get to know. And the next is
benefits of our nursing course. So first one is job security. So if you are a nurse, you have a job, you will get a job. That is very, that's a
one
special,
example I will tell, ma'am. Like one of my colleague only, I will share this one. She was like after marriage and all, she was in home only. She was become a housewife. Once she decided and she joined nursing, she completed GNM. After that, now her kids are like 8th standard, like that they are. But now she is not in home. Because she is nurse. Most of her in home only, right? We can see most of her working nowadays, most of her still village areas and all, they are in home. But if you are a nurse, you will never be sit without job. Okay?
If you got any gap in between, also after that you can go for job. There's no problem, nothing will happen. You can tell them that why the gap has happened, and after that you can join again and you can get the job. That because you don't need to feel shy.
Yeah.
Because some people are there difficult situations. So after that, they will, sometimes they have that urge to go for job again.
Yeah.
So you can go for job, nothing will happen. You can enjoy your life with the job. Yeah.
Definitely. So that is why like it's like a woman empowering media.
Now a job is very important when we are in here.
The next one is respectable profession, definitely, and global opportunities. That's what we discussed. It is getting an opportunity in the all worldwide, and career growth will be there. Financial stability. This is one of the hardest part we need to discuss right now. That what you are guys are finishing your 4th year. No, you can't expect that this much
High
amount
salary,
of salary we will get suddenly. It is not possible. My students try to understand the job first. Try to fix your mindset towards the job, and why your like intention should be strong, and you have to dedicate it yourself. Sometimes now like once we complete the study and we are joining, most of my students only telling, ma'am, that is different, this is different, that is different,
yeah,
this is different.
That too is very different, because when you are moving from the college to hospital, it will be so difficult for you at the first. Sometimes you will cry, sometimes you will get this call from doctors, nurses, in charge, but you have to fix into that.
Yeah.
There will be no
one
other
day
options.
it is not possible.
Yeah.
In one day everything we can change, it is not possible, but definitely the day
It
by
will
day,
change,
by practicing yourself, by dedicating yourself, definitely you are going to change. The changes makes you happy one day. So that is why for nurses, holding capacity is very important. For me also, sometimes I felt that my holding capacity is different.
But no need to worry, because whenever we are joining a hospital, they will give the induction classes, orientation classes, everything they will give. So we'll get some idea, and directly they won't give the patients to us. First they will assign with one of our senior. Then only they will give the patient. After 1 month only, some hospitals they will give the patient. So in that time, we have the right to study all those things within that 1 month. We all the persons are not perfect in everything. So we will take the time. By day, it will increase our skills, our knowledge, everything. So at last, we will be adapt to that area. Yeah.
That is very important. Why? Because if suddenly shifting your like from college life to like career, it is a huge difference and diversity area. Okay, so be good to your seniors, and who is going to teach you, give a respect for them. And
if you have any doubt, means just don't need to worry anything, you can just directly ask. Don't make the mistake. That is a very important, because it's a nursing profession and it's medical profession. We know that what it will happen if you've done any mistake.
If you're not knowing, no need to get the shy. I don't know whether they will think that if I don't know something else, Shamli ma'am will think bad.
No, never.
Why?
If
because
we are
she is
doing wrong,
excellence in something, I was in something. So that is the individual capacity. So for that reason, don't hesitate to ask some doubts to your seniors. Okay.
Without doing blunders, we can ask the doubt.
Yeah.
If you have anything, no issues. If you don't know that how to do, just tell them I am fresher or I am new. Just you can show me once. I will do later. Then you can set this directly to them. No need to worry. No need to get shy. Nothing will happen. ഓക്കെ ആൻഡ് ഒരു കാര്യം കൂടെ പറയാനുണ്ട്. ജസ്റ്റ് ഒരുപാട് പേർക്കൊരു ഡൗട്ട് ഉണ്ട്, ഇത് റെസ്പെക്റ്റ് കിട്ടാത്ത ഒരു പ്രൊഫഷനാണ്. മീൻസ് സം ഹോസ്പിറ്റൽസിൽ ചില പേഷ്യൻസിന് അവർക്കറിയില്ല നമ്മൾ എന്താ ചെയ്യുന്നത്. മീൻസ് നമ്മൾ ഇത്ര വർഷത്തെ കോഴ്സാണ് പഠിക്കുന്നത്, അവർക്ക് അതൊന്നും അറിയേണ്ട കാര്യമില്ലായിരിക്കും. അപ്പോൾ അവർ ചിലപ്പോൾ നമ്മുടെ അടുത്ത് ഇങ്ങനെ ചോദിക്കും, നമ്മളൊരു റെസ്പെക്റ്റ് ഇല്ലാത്ത പോലെ നമുക്ക് ചിലപ്പോൾ തോന്നും. ബട്ട് നോ നീഡ് ടു വറി. നമ്മൾ നമ്മുടെ പ്രൊഫഷൻ നല്ല 100% ചെയ്യുക ആൻഡ് വി വിൽ ഗെറ്റ് ദാറ്റ് റിസൾട്ട് ബാക്ക്. സംടൈംസ് ദേ വിൽ ഗീവ് ദാറ്റ് റിസൾട്ട് ബാക്ക് ടു us. യു ഡൺ എ ഗുഡ് ജോബ്. സോ ഫസ്റ്റ് അവർക്കത് അറിയുണ്ടാവില്ല. സോ നമ്മളത് ഒരിക്കലും ഒരു ബാഡായിട്ട് വിചാരിക്കേണ്ട. ബിക്കോസ് നമ്മുടെ പ്രൊഫഷൻ അത്രയും നല്ലൊരു പ്രൊഫഷനാണ്. സോ നിങ്ങൾക്ക് ആ ഒരു റെസ്പെക്റ്റ് കിട്ടുന്നില്ല, അവരത്ര നമ്മളെ ട്രീറ്റ് ചെയ്യുന്നില്ല, അങ്ങനെ ഒന്നും വിചാരിക്കേണ്ട കാര്യമില്ല. നിങ്ങൾക്കത് നമ്മളൊരു കാര്യം നല്ല ചെയ്യുമ്പോൾ നമുക്കത് ബാക്കായിട്ട് നല്ല നമുക്ക് തിരിച്ച് കിട്ടുന്നതാണ്. ഓക്കെ,
Definitely. So the next is job opportunities. We can see as a staff nurse. If you completed BS like GNM also, you will be appointed as a staff nurse. And the next one, don't tell that it's top nurse, it is a staff nurse. The next one is nursing tutor. So if you completed your BSc nursing and you having such sufficient 1 year of clinical experience, you will definitely go for a tutor job. The next one is ward manager. That and all that like depends on your experience, they are going to promote you in the hospital sector.
they will hire if you are interested. Means
The next one, ICU OT nurse. You can be like it is one of the clinical area only, and
Clinical
one of the
setting,
eye healing area. Okay, so your profession like eye paid area, those are. The next one is like work is also same like that only. The next
that's
one
also high pay.
then research nurse. Okay, so this is also very important. Nowadays in the government sector also, in the private sector also, they are hiring research nurse for multiple research purpose, and abroad nurse, that is what the global opportunities again. And the nursing officer, this is like all are calling as a nursing officer only. In the government sector, the like you are writing aims and
Exam.
all central government exam, you will be work as a nursing officer, like staff nurse job only. Okay,
If you want urge to get that government job, then you can go for that.
Yeah.
Like, yeah.
so these are the nursing job opportunities, and two more courses will be there. So that is like NPCC, nursing practitioner, clinical practitioner course will be there. That is also a post graduation course. If you want more information regarding the NPCC, please do comment it down in our comment box, and we will definitely let you make one video on that. So far we have discussed all the courses, what is the path and all will be, we have discussed nicely, and the like benefits also we had discussed. So if you have any doubts, please do comment. Shall we wind it up?
Yeah. So എന്തെങ്കിലും ഡൗട്ട് ഉണ്ടെങ്കിൽ നിങ്ങൾക്ക് ഇപ്പോൾ കമന്റിൽ ചോദിക്കാവുന്നതാണ്.
Thank you so much for watching our live session.
ഇല്ലായിരുന്നു.